Randy?
I would look to Derek. How are you, sir? Are you ready to go?
Yeah, let's rock.
Okay, it's 3 o'clock.
Let's rock.
Lisa, if you can just tap the mic to make sure that's on.
Sounds like it is. So, welcome. I'm Lisa Clute, Executive Officer of First District Health Plan Unit. With me is Randy Schwan from Trinity Health, Mayor Sipmer, and Ward County Commissioner Chairperson John Fildall. So we just wanted to give you a quick update on where we were in response to the COVID-19 and have time available at the end to answer any questions that you may have. So, as you know, we have 3 positive cases confirmed here in Ward County. There are 34 in the state. In relationship to what First District Health Unit is doing right now, we have limited services to help stop the community spread. Those services that we are providing are TB, HIV, STDs, some immunizations, and our water lab is still available. So those that are needing to do water testing, we're open for business. You can go to door B and drop off your water samples. I wanted to review what First District Health Unit is responding to and the questions that we are receiving. So some of the questions involve illness. If you have a fever of 100.4 or greater, cough or shortness of breath, contact your health care provider for further guidance. If you don't have a health care provider, contact Trinity Health at 857-5000. If you have been in contact with anybody with COVID-19, you need to call the state hotline at 1-866-207-2880. They are available to answer those questions from 7 a.m. to 7 p.m. If you have traveled to another country or state and returned within the last 14 days, please go to the North Dakota Department of Health website to self-report and follow the guidance that they provide you. For other travel or contact-related questions, call the state hotline at 1-866-207-2880. We have received several questions regarding food establishments, lodging facilities, care facilities. You can have those and any assisted living facilities. You can contact us at 852-1376. That phone is answered 24/7, and we have environmental health available to answer those questions. If it pertains to food, lodging, or health facilities, we will investigate that and make the proper recommendations. Guidance for food and lodging are changing frequently. That's an understatement. So we need to follow that guidance, and our staff is up to speed on that and responding with the appropriate guidance at that time. It's important to realize that at this point, the businesses in town, with the exception of food and lodging, have not been asked to reduce services or shut down. The governor has recommended that employers do what they can to assist the community in social distancing. So anything that employers can do, that's great, but they are not required at this time to do that. It all boils down to it is the individual's responsibility, and I can't emphasize this enough. Please, please follow the recommendations for social distancing. I want you to avoid any gatherings, malls, workout gyms, mass transits, play dates, concerts, theaters, traveling, crowded retail stores, church services, non-essential workers in your house, and visitors to your home. That's really what we want you to avoid at this point. It's not the business responsibility, but it's your personal responsibility to follow those recommendations. Keep your distance at the grocery stores, local restaurants for takeout, and picking up medication. Also, if you, it's beautiful outside, if you go to the parks, keep your distance, but enjoy the weather and utilize the parks. Just keep your distance. So, if you need to be out in the community, again, and I know you've heard this over and over, but keep the 6-foot distance between you and another person. I know you hear it over and over again, but it is truly how we stop the spread of COVID-19. And in order for this community to survive, and in order for the health of this community, to protect the health of this community, we need your help. So please follow these recommendations. Thank you. And I believe
Maybe
Randy.
Thank you. So as Lisa indicated, this is a fast-changing environment we work in today. I'm here to share with you some of the current guidelines and know that by the time I get back to the office, some of them will have changed. But before I take your questions, I wanted to make a few points, if you don't mind. So first, I'd like to thank all the hardworking men and women of the healthcare system in this region. I'm honored to be on their team and watch what they do every day. They're taking care of patients in our clinics, hospitals, and nursing homes, and other facilities in this city, and they're doing a great job. And it's humbling to watch that happen. I'd like to thank Governor Burgum and the North Dakota Department of Health for their efforts to coordinate our response across North Dakota. I think they're doing a great job. And it's, again, a fast-changing environment. We've got a press conference coming up. I'm excited to see what's on there as you are. Earlier today, our CEO, Mr. John Kutch, talked to our team about a couple of very important points. First, stay calm. And reduce your own anxiety. It's a healthy thing for your body and your family and your neighborhood and our community. So that's the first thing. He reminds us of that often. We appreciate that. He also reminded us of the support that we have in this community. The local support has been overwhelming, and it's only started. Our leaders like Mayor Sipma, Minot Public Schools, Mark Vollmer and his staff, leadership team. Amazing cooperation, leadership, and guidance. So thank you for your efforts. The other day, Governor Burgum suggested, I think it was on Saturday perhaps, about retired employees who might have retired out of healthcare in recent times and whether or not they're being asked to come back into service. I wanted you to know that we are exploring that option and doing some research and preparing for that initiative to launch here locally. We haven't started that yet, but we're preparing for that eventuality. We haven't needed the help yet, but we know that prolonged increased intensity of this may resort to that. We do have an adequate supply of testing kits. We do have an adequate supply of testing kits today. So we are following the State Health Department guidelines on who gets tested and who does not get tested. So if you are symptomatic and you feel that you've been exposed or have the COVID-19 virus, do not go to the ER, do not go to your clinic, do not go to the drive-in clinic that we are operating now. We opened that drive-in clinic a couple, 3 weeks ago. We were the first in the state to do that. We have tested quite a few people in this area because of it, but it's by appointment only. So you must call 857-5000 Explain to them that you think you're a candidate for the drive-in clinic, and they will forward you to our testing center where they will screen you based on the latest criteria by the Department of Health. Now, on my way over here today, that criteria changed again. So we're trying to keep up with the criteria, and I can go over it in a little bit if you'd like. But we are not testing asymptomatic people or those without symptoms because we've been asked not to by the Department of Health. We're looking at a lot of other ways to adapt to this changing situation. We're looking at telemedicine, for example, having the ability to see patients without having them come to the clinic. We're looking at phone-in type clinic appointments. We're trying to be creative and take access into our clinics without having large people gathering. So we'll make more announcements as those go live. So if you have symptoms and you need to be seen, make sure you call ahead first to the ER or the doctor's office. Stay home. If you're sick, stay home. It doesn't matter if you've been tested or not tested. If you are symptomatic, you must stay home. The test itself, it really doesn't change the course of treatment. So the rest of us need to follow, as Lisa pointed out, good social distancing practices. We must do that effectively. And finally, one more point. Trinity Health is still open for business. As Lisa pointed out, many businesses are still conducting business and need to conduct business as we do. Our physicians are still seeing patients that are not complaining of COVID-19. There are still injuries that take place. You might have some other kind of infection. If you need to see a physician, call their office and make an appointment. We'll still meet the needs of the community as we have in the past, whether you're COVID or non-COVID symptoms. Those are my comments.
Well, first of all, I'd like to thank everybody who helped organize this today. I realize there's been some concern out in the public of having this joint message coming from the cities and the county and our health people that provide those services. I guess from the county standpoint, I'd like to say we're doing businesses not as usual, but we're doing business and keeping everybody employed at this time in various different ways, but still providing the services the county has always tried to. The one limiting factor is the administration building has been noticed as locked down except for appointments. So if you have to do business at that location, call ahead. We have several departments that are operating within our county buildings. Some are operating remotely and some may more in the future, depending on the status of this ever-changing event. We have departments such as the Department of Schools that works and is going to communicate with all school districts in the county and try and get a unified message and carry that through these type of venues in the future. Sheriff's Department is still operating. The lobby doors in the jail are open to the public, and going further than that, you have to make arrangements. And they're patrolling as they always have and continue to operate in that manner. Veteran Services is another one. If veterans have to have services, veterans are encouraged to call ahead at the VSO office. Our courthouse, as you know, is still open to the public, and there are non-jury trials being held there, and until further notice, that's the way it should continue. On the human services side, what used to be social services, they would like those that are applying for financial assistance, they're encouraged to pick up packets just inside of the front door of the courthouse, fill out the packet and place it and drop it in the box in front of the administration building. The department head wants that message understood in the public, so we want to emphasize that. They're still available, just not face-to-face contact. They're not doing the face-to-face contact with interviews. They will contact you by phone or some other telephonic method. And some of them are working remotely too. More hopefully will be working remotely as we get hardware in place to be able to handle that. The Emergency Management Department, headed by Jennifer Weichman, is been in contact with the cities as well as I have outside of, or inside of this county, outside the city of Minot, and encouraging them to stay in contact with her or the county commission should they have any issues they want to address. And I can say from discussions with them, there haven't been hardly any incidents that are concerning them right now. They're reacting on the governor's recommendations, and so far it's been going okay. I'd just like to emphasize to everybody to, if you have the concerns as like the other people have mentioned, get a hold of First District Health or Emergency Management if you have questions or concerns about anything that you would like answered, and they'll do their best to find those answers for you. And like it has been reiterated, this is a changing, ever-changing event here, and so that doubly makes it difficult to stay on top of things. So if you have questions about some of those changes, those are the people to contact. Having said that, at this time, I got a report from all the cities within the county, and most all their offices are temporarily open, so they're not open every day of the week. Some of them are open on their normal hours, but just, I would encourage you, if you have to contact them cities, they wanted that message sent out, that get a hold of them ahead of time so that they're prepared for you. So with that, I guess, wish all the residents of Ward County, we'll get through this. It's just going to take a little time. Thanks.
Well, good afternoon. I think it goes without saying that these are certainly difficult times, but they're certainly times that we are all going to get through this if we do it collectively. I'd originally written down do it, being able to get through all of this together, but maintaining the social distancing messaging I think is always important. So this is certainly the more that we come together collectively, the better we are going to be as a community, as a region. I do also want to start off with saying thank you to all of the partners and collaboration that has transpired over the last couple of weeks. Of course, First District Health Unit, Trinity Health, the County Emergency Management, all of our fire, police, Ward County Sheriff, ambulance, first responders, and the rest of the partners, not only within the community, but throughout the region, that are working very hard together to help each and every one of us get through this as best we can. In addition, as this joint press briefing is being put out there, it's showing a collaboration between the Joint Information Center, the JIC, as has come together with not only Ward County Emergency Management, the Public Information Office, but the CVB, Visit Minot, and the rest of our partners, as a continued effort to get accurate and up-to-date information out to the public as often as possible. And that really is the main effort here, is to get information, accurate information, out to the public as quickly as we can, because as has been said and will continue to be said many times, this is an ever-evolving situation. So accurate information from the source is critically important. Now, we're also aware that we likely have more than three cases that are positive in Ward County for COVID-19. Testing certainly is an effort to identify those, and that will continue, as the healthcare providers, First District Health Unit, have said. That being said, I think it's also important to recognize our numbers have not been increasing like some other areas. It doesn't mean necessarily, though, that they're not out there. And it's important that we don't become complacent as well with those numbers or other areas that don't show those infections on the map. This is about vigilance and self-responsibility working through this pandemic. As we see events that take place, or whether it be shopping, go out in public, something as simple as going to the grocery store, that very important individual responsibility plays the biggest role in all of this. Because the more that we pay attention to washing our hands, not touching our face, but being careful of what we touch, but keeping distance from people, helps prevent that spread and flatten the curve that we've all heard about. Also, as we go out, we're all aware of the economic impact throughout all of our communities. This is going to be, I think, one of the most tumultuous times, even considering the 2011 flood, that many of us will ever endure, at least that I'm aware of. That is going to mean going out and trying to support as responsibly as possible the local businesses that are in all of our communities, whether that's curbside pickup, whether that's delivery, buying gift cards, but reaching out to our local businesses to ensure that we help our own economic conditions within our community through this crisis. That I cannot stress enough. That is critically important. As far as city operations go, we do have some changes. However, we will be looking at no disruption to water, sewer, or sanitation services. The city offices themselves will remain closed to the public unless for last and the ultimate circumstance that an in-person appointment does need to be made. Again, like everywhere, call ahead. The offices will be closed to the public as we try to ensure the safety of the employees here and work towards the continuation of government. The library will also be closed and is looking like that will remain closed for the foreseeable future. Fire and police department will remain in force through the duration of this, which also leads to the next component of what we've been working on. And Randy had kind of mentioned that as well as First District with Lisa here. Mid last week, we jointly got together and put together a very quick expansion, essential personnel daycare for Trinity Health, for the essential workers of fire, police, and we did add water treatment and wastewater to that. They are separate daycare facilities that are being overseen by a local daycare provider with the help of Minot Public Schools, CLC program, First District Health Unit, Trinity Health, and of course the staff in each of those entities, including City of Minot for Fire and Police and also Ward County Sheriffs, so that we have a list of all of those essential personnel so that we can ensure that the staff at those facilities within those departments are able to go to work and that childcare doesn't prevent those folks from getting to work. So very happy to say that actually started yesterday, and we expect some of those numbers to ramp up as the duration of this continues. Inside City Hall, we have also put together a COVID-19 task force that's internally looking at what we can do not only for city operations, but to also on the outside in terms of community interaction and community involvement. We have already made some policy changes that enabled businesses to conduct business in a different way for curbside pickup or deliveries, and we're certainly looking at other aspects that we can also help businesses weather these economic tough times. And we will continue to work through all of those operations, and I have a laundry list of different pieces of operational adjustments that we've made internally, everything from working from home, standing up janitorial staff that are going through the buildings several times a day and wiping down everything, cleaning everything. I think these are all policies that many businesses remain open are doing themselves, but better business practices. We have canceled all staff business travel, all unnecessary travel, so that we can ensure that the continuation of government is well at hand here. And then also continuing to continually discuss and talk and reach out to all of our partners within the community so that information is flowing freely between all of us at all times. And that way, each one of us can make the best decisions that we can for ourselves. And if other entities have some stand-up ideas and suggestions, that we collectively pass those along to each other. We're also having at least at this point, weekly discussions through the North Dakota League of Cities for the mayors and staff for all of the different cities, so we can also take a look what is happening within the other communities and see if other communities are doing different practices. But collectively right now, it looks as though most cities, if not all cities, and many of the counties as well, are all on the same page with a lot of the practices moving forward. Of course, we have our challenges within the city, of course, with IT and VPN networks working from home. But I have to say a big thank you to our IT staff that has done an outstanding job of launching us forward in a very short amount of time to ensure that those folks that need to work from home or that are able to work from home, so that we can continue to work on social separating here at City Hall for the continuation of services. There's certainly a lot more I could talk about, but we are on a 4 o'clock deadline for the governor's press conference today, so I want to leave some ample time for questions, so that I will go ahead and grab a seat. And I would only ask for anybody that does ask questions. We do have a microphone so that we can get those questions from any of the reporters or press that are in the room, so that people at home can hear them. And then we'll ask whoever it's directed to maybe repeat it, and then we can answer it and get through this and still make sure that people can tune in for the governor's press conference at 4. Thank you so much.
Good afternoon. Chemp with Hometown Radio Group, located in Botno and Minot. The first question that I have, there's going to be two, would probably be for Lisa. I know that we're all physically present conducting this press conference from Ward County, but please be aware that there are people listening and watching right now from all of the counties that First District covers, as well as other counties that it doesn't. In addition to Ward County, the First District also includes Botno, Renville, McHenry, McLean, Sheridan, and Burke counties. And one of the pressing questions that I've been trying to get an answer to is how many tests are being conducted in these counties within the First District, and how many positives are there. And it would be real helpful if in the future, as we go forward, that all of these counties are addressed at the beginning so that they don't feel left out. Because you guys know that a lot of times these smaller towns feel left out. So Lisa, do you happen to have information on testing in those counties for us?
Absolutely. And first of all, you're correct. First District Health Unit does serve 7 counties. We are very involved in all 7 counties in their response to this. They are working with their healthcare providers. We have offices in each of the counties, and those office staff have been working with emergency managers in preparations with this. They work all the time with them, preparing and doing exercises for events such as this. So certainly, in each of those counties are responding uniquely based on their community situation and resources and so forth. So we are supporting them, providing them the tools that they need to continue in their planning. So yes, in response to the tests that have been conducted, at this time there are no cases other than Ward County in the 7 counties that we serve. The tests that have been conducted, this is as of noon, so stay tuned. But in Ward, we have conducted 247 tests. Renville, 2 tests. Botno, 14. McHenry, 9. McLean, 15. Sheraton, 0. And Burke, 4. That information is available on the North Dakota Department of Health website.
Excellent. And
Thank
then
you.
the next question might be either you, Lisa, or Randy. Another thing that, the press is trying to put out there, we, on our radio stations, we're live and we're putting out real-time information. So whenever we get an update on the protocol for testing, we put that out to our listeners. And so what I'm hoping is we can establish some sort of lifeline or a communication line so that we are putting out accurate information and not causing problems with the testing locations. And I heard a couple of conflicting pieces of information, even because Randy mentioned that the protocol had changed as he was driving over here. So is there somewhere that we as media can go, or is there some way that we can get the updated protocol so that we're putting out the right information at the right time to our listeners or our viewers?
Okay.
And can we get the definitive protocol for right this second, right now?
I can answer both of those questions, I think. The guidance that had changed, that we received the email on at 2:30 on our way over, was that the clinical features or healthcare providers should consider testing the following patients. Clinical features, and this is the thing that's changed a little bit. Fever or 2 of the following signs and symptoms of respiratory illness with new or worsening onset. And that's cough, shortness of breath, sore throat, chills, and fatigue. That information is available on the North Dakota Department of Health website also. Under the coronavirus, it should be there for the providers, and you can have access to that. I can talk with you after the press conference in regards to that, Jean. And so that was the biggie that was changed on the way over, is that now we need 2 of those symptoms prior to testing. I know that there is a lot of questions in regard to testing. We follow the North Dakota Department of Health recommended guidelines, and that is, again, ever-changing, as today would indicate. But that is what we are following. And when that information becomes available, it is sent out in a health advisory alert to all medical providers. Now, that alert comes in the form of an email and is sent to all of them if they are serving a patient at that time. They may not receive that as timely as what we may have this afternoon, but that goes to all healthcare providers throughout North Dakota when that changes. And Randy has additional information.
Thank you for the question. So as providers, as Lisa pointed out, we get Health Alert Networks sent to us across the state. All providers get it simultaneously. Oh. Sorry. So as providers, when we get a Health Alert Network advisory, we have our incident command system set up at Trinity Health, and somebody's watching that network all the time and printing out those advisories and going through the whole dissemination across all of our clinics and hospital and reception areas and switchboard. And so we try to do that in a timely way. We would prefer to test everybody, right? That's our premise. We start with that, knowing that test supplies are limited across the country, across the world, and in North Dakota. We happen to have a supply right now. We have driven to Bismarck, we've driven to Williston, we have sent people across the country to get more supply. We'd like to test more. We have enough to go through the week without any question. Depending on the volume at our drive-in clinic and how many people call for a test appointment, we'll adjust accordingly. We'll let you know when we run out. We will test as many as we can within the guidelines that have been given to us by the Department of Health. And it's going very well at the testing site. People are patient and they're understanding. Our staff is doing a rock-solid job of getting it done under very difficult conditions. These people are approaching folks who they suspect, who they believe anyway, have COVID-19, the virus. And they're giving them the test and providing the state of North Dakota the sample for testing. We do not do that in our lab. And that's why when the state says we do not test asymptomatic or those without symptoms, if we took your test and sent it, they wouldn't run it anyway. So it's not Trinity Health that doesn't want to test you. We do want to test you. We do want to test as many as we can to help the epidemiology and the researchers understand where we're at in the state with our exposure. But we're testing who we can, and we're treating everybody who needs to be treated.
Average number of tests per day?
So we have had 50, 60 a day through that clinic and through our ER. We have a number of sites that we do testing. We do some testing in our primary care physician offices, not quite as often, obviously. We prefer to do it with the no-contact drive-in clinic, and that's where most of the folks are, that's where we're getting our volume of tests. We're geared to do higher levels than that. I think over the weekend we might have had 15, 20. So anywhere from 30 to 50 a day is kind of what we see now. And at that rate, we can continue for the next week or two. Any other questions about testing?
What is the average current wait time for a test right now?
From the time the test is taken to the time you hear about the results, is that what time you're
If you call in to schedule, or if you call in and the physician determines that you need to be tested, how long after you make that call would you be on the schedule to come in?
It's a great question. Depends on the volume of other callers ahead of you, but typically same day.
Okay, same day. As far as the cost for the testing, are the uninsured able to access the tests, or is there a scale basis or anything like that for them?
Yeah, they're free across all providers. So we don't take your insurance information. We don't demand any or ask for any kind of fee. The testing is free.
Okay, not about testing, but as far as medical supplies, are you able to keep up with the demand of like respirators and other devices that you might need?
So the question was around other medical supplies outside of testing. So know that around for these symptoms, there's a variety of medical supplies that we are maintaining a supply of and asking for more through our own suppliers, through the state emergency cash system. Well, I'm not going to get into specifics about how many gowns do we have, how many swabs do we have, how many gloves do we have. We have respirators, and we have gowns and masks and those kinds of things to treat this. We go through them typically every day of the year. Now, this is definitely putting a higher demand on those critical supplies, and we're working very closely with the Department of Health and other providers across the state to ensure those who need it most have more of them, right? We know that respirators, if you've paid attention to national news, ventilators, there's a big talk about ventilators, and there's a lot of conversation around N95 masks. So we've been fortunate, actually, in the last couple of days to have people who have been community-minded and caring bring in some N95 masks and drop them off at our facility. That's wonderful. We have some N95 masks still. We know that there's a supply of N95 masks at a warehouse in Bismarck to be distributed to those who need it most. So in keeping with that supply, we are also asking those in the community who might have more N95 masks that they're not going to use, we would certainly take them. Our healthcare providers are face-to-face with this every day. As you've heard, we have patients in the hospital, almost steady now for the last couple of weeks with these symptoms. And we go through a lot of masks. And so I'm not worried about having too many masks. People know where we can get some. I'd like them to call me. If they have some and they're not using them, I'd like them to bring them to us. I think we have information before we close about surgical masks as well. There's a supply of surgical masks in the state. We have a supply of surgical masks, which are just more common everyday use masks. You might be asked to put one on if you come to the hospital to see somebody, if you get through all the visitor restrictions that are in place right now, and I know that that's another sore point, but necessary to keep our staff and patients healthy. We're limiting exposure to people who may be symptomatic. So we're working with the Ward County Emergency Management Office to put out information about surgical masks. There's been a lot of people asking about, hey, I've seen this pattern on the web, and I know there's a hospital in Oklahoma or New York that's asking for surgical mask donations. And I'm here to ask Jen to talk about this afterwards perhaps, but we will help in that process, and we would accept those kinds of donations as well. Please, yeah.
I had a question for Lisa,
I d-
actually.
Okay, I just wanted to add to what Randy said. This is something that we prepare for all the time throughout our 7 counties, is what we call the surge capacity. And so we have in our possession in this community, ready to go up an additional 100 beds with sheets and all of those kind of things. We have those systems in place. I know masks and ventilators are what you hear most about right now, but there's a lot that is involved with supportive care, staffing, supportive care, all of those sorts of things. So throughout the 7 counties, and particularly Minot and Ward County, where our largest hospital facility is, we are prepared for that. And this is not something that has just come out of the blue for us. We stand ready always to deal with surge capacity. Thank you. And Jean, I'm sorry, you had another question.
As we all know, in the absence of fact, rumors run rampant. One of the problems that the press has been dealing with is we keep getting cited with HIPAA violations when it comes to trying to narrow down the town in which cases are diagnosed. And we do fully understand that, that problem for us and your obligation to not break the law in revealing information. However, when there was a case diagnosed in Pierce County, the hospital did announce that the case was there. They did not identify anyone. They did not, break any laws. They did not violate HIPAA laws by assuring the public that, in a press release, that they had this under control and that they had taken steps to make sure that other people in that facility were safe. Is there a reason why HIPAA is being cited as a reason to not let the community know if their town has a positive case? If it's not giving any identifying information and not, not putting the patient in jeopardy or in an uncomfortable situation, please explain how that would be a HIPAA violation if you're not naming names.
At this point, our directive from the State Health Department is to identify the county in which that resident is. I oftentimes don't have all the initial details on that either. When a case is identified, and this is the way it goes, when a case is identified and it comes from the lab, it goes to the State Health Department. Each of us have an epidemiologist working within our region that works closely with us. They contact me and they begin the investigation process. They meet with the patient and begin identifying potential contacts and so forth. At that point, First District has always, when that initial contact to the patient has been made and we've been notified, we've always let the press know, yes, this is, we have a case within Ward County, and often that's released before the State Health Department releases that information. That investigation that is happening at the same time that we are indicating to you is identifying if we have any potential health risks in our community when they are meeting with that patient. If for any reason there was a health risk to a community that was identified, we would immediately act on that. at this point, there is no, and that is their first, that is what their investigation is there, is to identify possible risk. If it was identified that a community may have community spread or any of that, we would certainly act on that immediately. If it is not identified as a potential threat to the community, then there is no reason to identify or to respond to that.
I know we're getting pretty close to the governor here, but my question was for Randy. You mentioned how you know about the test supplies that you have available today. I'm just wondering how well you will be able to predict this as time goes on in an admittedly unpredictable time for everyone.
Yeah, those are key words, admittedly unpredictable. I don't know if I could, I don't have a, silver ball. I think a few things at play. So we have adequate supply at the current burn rate. We call it a burn rate, a run rate. So the average use right now, we know that we have supplies through this week and probably into next week. If, because the guidelines might be relaxed a little bit as about 2 o'clock today, we might have a higher level of volume coming into the clinic, and we might be out by the weekend. So it is really hard to predict. We know that there is a lot of effort across the country to obtain more testing kits. I've seen President Trump talk about that, as you have. We've talked about it at the state level. So if we get more, and we expect to get more, I don't know the timing of that. All bets are off, and we'll have lots of kits, and we'll be able to expand our testing guidelines, I'm sure. Because I think the state is on the same page with us in that we want to test more, not less. So if we get more supplies, they'll be relaxed more and the number will go up. But right now, we're pretty confident we can keep up with our local regional demand with that.
I believe this is a Trinity question, but I wanted to ask about people who get the test, if they have to wait very long, and is there an effort to get other labs testing other than the state lab in order to get these results back more quickly?
That's a great question. So I think the governor talked a little bit about labs and the labs that are being used by the state health department. We're not choosing them right now. I know there are a couple of commercial labs that are being used by the state for that. I know they're trying to find more, and they're trying to find, there's actually different tests and different mediums that are coming out now too to help reduce that timeline. I think we've been experiencing less than 24-hour turnaround. And that's why in my opening remarks, I talked about the Department of Health and the work they're doing has been remarkable. I know the volume has hit them hard, and they've been able to adapt, and they're getting the test results back in 24 hours or less, which I think is pretty amazing given the volume. Other labs are coming online. We know that. We've heard that, and we expect that to even get better over time. Does that answer your question?
Okay.
Any other question?
One more question, and then we need to wrap it up. So, what?
This is actually for one of our officials. As you've had more workers begin to remote work, basically, have you seen any different changes on what you need to prioritize? Do you need to have different productivity expectations? And also, Mayor, you were mentioning the importance of getting the information out, accurate information, of course. These are new weekly pressers that you are planning. Is there any other avenues that you would like people to know about for them to get that right information from you?
Thank you, Ben. Absolutely. We through our internal task force are going through the priority list of really identifying what is at the top of the priority. Of course, right now, going through all of the different workloads and ensuring that the folks that are working at home have that access through VPN networks. Our IT people have been just working around the clock to make that possible. I had mentioned earlier that the library closed. However, they still do have drive-up services over there. Some of those folks are working through backlog, and then others are being being retasked to address some of the other aspects that maybe aren't being able to be handled otherwise with some of the other people spread out, staggering work shifts where possible. So we are really identifying what is top priority within the community, as well as talking with our partners in the community to see if something else needs to be elevated at the city level. With that in mind, we are continually talking with the mayors, as I mentioned earlier, from other communities to take a look at what they are tasking. And right now, it seems to be that everyone is kind of on the same avenue of addressing. I think as we move down the road for future meetings, and I do want to address that because that's been a question that's been brought up a couple of different times for public meetings here at City Hall or whether it be the county. The Attorney General did notice that those meetings are to remain open to the public, but is encouraging, of course, for anybody who is able to view at home, whether it be through maybe a Facebook Live or a social media opportunity there, that if they wish to engage, perhaps they watch at home unless they absolutely have to come to City Hall or to the county or to whichever board that they're going to be attending. But those meetings absolutely are going to remain open to the public, and we're going to try to prioritize of course, the items on our itineraries so that we push the pertinent issues to the forefront during those times. The last little piece that I wanted to mention as well is on the busing, that our buses are running. We do have hand sanitizing stations available there on and off, and we encourage people that to be very mindful social distancing if they choose to take the bus to go and get groceries, to go to the pharmacy or whatever it might be, but to always be very mindful of that social distancing. And the last piece that I will mention, as we are now 9 minutes from the top of the hour here, is that we're social distancing, and the governor talked about this a little bit yesterday. Just because we're spending more time apart doesn't mean that we shouldn't be communicating with others in our community. It's especially important to reach out to maybe those that are at risk, that are self-isolating, and reach out, if nothing else, but to have a conversation and continue that person-to-person contact through the phone or in some cases, Facebook Live. Not everybody has social media, but this is a great opportunity. I've been reaching out to faith-based groups in the community who are reaching out to their parishioners, but to ask that question, is there somebody else that you know of that maybe needs a phone call or errands run for them? This is an opportunity for the communities, while staying apart, to come together.
I want to thank you all for attending today. We hope this provided you some answers to questions that you may have had, and we will continue to provide you information as soon as we can and as swiftly as we can with this evolving situation. So thank you. Stay well, stay safe, and stay home if you can.